Leishmania are closely related to a single-celled parasite species which are responsible for the disease leishmaniasis. Leishmania mexicana. Leishmania needs the help of a blood-sucking arthropods, namely the females of sandflies, to spread. Why females? Because they're the one that suck blood. And when they do that on an infective host, they ingest the parasites and at the next bite inoculated into a new one, sandflies have an exclusive contract to spread Leishmania. There are two morphological forms of the Leishmania in its life cycle. The first one is the amastigote and the second one is the promastigote. The only difference between them is their flagellum. One have, one don't. Forest rodents are the main reservoirs of Leishmania, and humans are the definitive host. Leishmaniasis mexicana can be found in Mexico, Central America, South America, Middle East, Asia, and Africa. Most of the affected countries are in the tropics and subtropics. The settings in which leishmaniasis is found range from the rainforests in Central and South America to desert in West Asia. More than 90% of the world's cases of visceral leishmaniasis are in India, Bangladesh, Nepal, Sudan, and Brazil. Inside of a sandfly, Leishmania is present in what is called promastigotes, wielding a flagellum and blocking the fly's sucking apparatus, together with its bunch of its friends. During the bite, the insect sort of sneezes out the parasites right into the brand new host, and inside the host, immune cells of the body attacks and devour the promastigote. And while they are celebrating a job well done, Leishmania, instead of dying, they shed the flagella and morph into fat amastigotes right inside the immune cells. They divide. This is one of the Mother Nature's ironic tricks that the parasites replicate inside the very cells that they were supposed to kill them. However, cells tend to get crowded after some time, so amastigotes escape by ripping them open, after which other immune cells pick them up. A bunch of imbeciles. This is how leishmaniasis spreads in the tissues or even in the whole body. If it enters the bloodstream, sandflies will of course easily siphon off some of the amastigotes, goes from the bloods and will transform them into infective promastigotes in 6 to 9 days, and we're back to where we started. Lesions and symptoms. This depends on what type of Leishmania species you were infected and the type of strength of immune response. The mildest symptom form of disease is cutaneous leishmaniasis, which producing deep oozing and crusty sores of the skin lasting for months, during which they can grow or multiply along the paths of the lymphatic vessels, where they eventually heal. They leave insightful jug scars. Somewhat worse is the mucocutaneous form of the disease, which is characterized by the horrible destruction of nasal and oral tissues. This could possibly lead to death, but at the very least its healing is followed by a significant decrease in quality of life. The most severe form of infection is visceral leishmaniasis, which attacks and kinds of liquefies the spleen, the liver, and the bone marrow, and is quite often fatal. The different categories don't always present themselves in clear separation, but using them is still practical, as they can generally be linked to specific leishmaniasis with entertaining and easy to remember Latin names. Diagnostics. Symptoms detailed are suggestive enough but can also indicate other illnesses, so our goal is to detect the presence of the parasite directly or indirectly. Amastigotes are often visible through the microscope and tissue samples taken from the source or from the bone marrow. However, it is easy to glance over them if they are only present in small number. It's much more reliable to look for the genetic material of leishmaniasis special method called PCR. This also works with only a couple of parasites loitering about. Detecting antibody is produced by the host immune system against the germ is also an option, but unfortunately, Plenty of times, no antibodies can be detected despite an active infection. A negative result, therefore, is not to be trusted. There are no substances that reliably destroy leishmaniasis. It can be treated to ease the symptoms, even to kill some of the parasites, but complete eradication is up to the host immune systems. Drug of choice and prevention. Protection and prevention from sandflies. You find yourself where sandflies live and thrive, use mosquito repellents, long sleeve or insect screen, pretty closely woven ones. You can expect sandflies to attack after sundown or at night. Sandfly oppose of those mosquito don't develop in water but in decomposing organic matter.